So sleep disordered breathing, there are many presentations for it. You've got snoring, which can be habitual or constant. We have upper airway resistance syndrome, obstructive sleep apnea syndrome. On the spectrum of severity, we have the occasional snoring, the habitual snoring, and then we've got the upper airway resistance syndrome, occasional apneas or hypopneas, and then, of course, the OSA syndrome, obstructive sleep apnea syndromes. In my practice and in the practice of my colleagues at Beam Readers, we tend to use these numbers as a guide for determining the risk probability for obstructive sleep apnea. I want to emphasize that these numbers don't mean that a person has sleep apnea. If someone has a small airway, there's an increased risk for obstructive sleep apnea or sleep disordered breathing, but that doesn't mean that they do have the disease. Whereas I've seen people with really large airways, larger than 100, larger than 150 millimeters square, that experience sleep disordered breathing. And that's because it's not just about the size, but also related to the tonicity, integrity of the airway when a person falls asleep.